Have you been offered to participate in a breast cancer clinical trial or are interested in finding one? We will teach you all about it. Only 5% of all breast cancer patients participate in these cutting-edge research studies. But adding a complex clinical trial to a stressful situation where you're trying to learn about your breast cancer and make treatment decisions, these can be difficult choices, and we're going to give you the information that you need to know to make the best decision for you. In this lesson, I'm going to teach you exactly what a breast cancer clinical trial is. What are the possible advantages of participating in a clinical trial? I'm also going to share with you the risks that can come with a clinical trial, and I'm going to show you the best way to find clinical trials in your area or in the country that may apply to your unique breast cancer situation. So let's get started. So what is a clinical trial? Any new cancer treatment, such as a new medication, let's say a new chemotherapy, or a new treatment, a new type of breast radiation, or a new device that's used for cancer treatment, must go through clinical trials where they test it on patients with cancer to prove to the FDA, the Food and Drug Administration, that it's not only effective, but safe. So let me give you an example. Let's say there's a new type of chemotherapy that's been developed and tested in many ways that's felt to possibly be better than the current standard of care chemotherapy. So a clinical trial will take 100 or 1,000 people and give it the standard of care treatment, and take about 100 or maybe 1,000 of patients and give them the new treatment. And then the clinical trial follows these patients over years to see if their cancer comes back or the cancer responds to it and how they do. And then after those years of follow-up, they will analyze the information to best determine if the new treatment is as effective as the standard of care, possibly more effective, and also possibly less effective than the standard of care. What are the advantages of participating in a breast cancer clinical trial? Well, really what you're looking for, the first benefit, is that you're trying to get access to new treatments, chemotherapy, a device, a new treatment that is on the horizon, and you're hopeful that that treatment will prove to be better than the standard of care that it was at the time where you had to make a decision about your breast cancer treatment. There's no guarantee that whatever treatment or whatever trial you participate in, you will actually benefit. The treatment may be as effective and the treatment may not be as effective as the standard of care. So there's a little bit of risk there. But this is where you can seek out new promising treatments that are not available on the market. The second main advantage of a clinical trial is that you're adding to our knowledge, and by your participation and the information that we gather, you can improve the cancer treatment of people in years to come and generations to come. The way to think about it is that any chemotherapy that you're offered or radiation therapy that you're offered is based solely on the generous participation of patients in the past that participate in clinical trials to prove that those drugs were better at the time than the standard of care treatment at that time. So you're helping yourself possibly, you're helping others in the future, and it's important to remember that you have been helped by others that have participated in clinical trials in the past. What are the risks of a clinical trial? Well, there are three: adverse events, worse outcomes, possibly, and I just want to share with you that you don't want to feel pressured into participating in a clinical trial. Let's cover adverse events. So we learned from you and other participants whether patients have complications or side effects from a new drug or treatment. I'll give you a couple examples. Let's say there is a new type of breast radiation to lessen the chance of cancer coming back in the breast after a lumpectomy. Well, radiation can cause skin changes, can cause some pain in the breast or cosmetic issues. Most of the time they don't, but they can. They're called adverse events. And we might find out, you participating in this new type of radiation, that there were worse skin changes and worse breast pain and worse cosmetic outcomes. So you have to know that that's something that you might experience that we don't know yet, but we're going to learn from you. A different type of adverse event might be a new hormonal therapy, which so many women take with breast cancer. And through your participation, we might find that there's a higher chance of having severe hot flashes, or a higher chance of having blood clots, or a higher chance of having bone loss. So we will learn from you. You're sort of our guinea pigs, but we will learn about adverse events. So it is a risk. It's not an overwhelming risk. I've already covered the possibility, although not generally common, that your outcome will be less successful with the new treatment that is being studied versus the standard of care treatment. It's not that common, but it can be a risk to you. And a third risk, or maybe shall I say a piece of advice, is that I don't want you to feel pressured into participating in a breast cancer clinical trial by the doctors that you're seeing. Let me give you an example. So you see your doctor, it's kind of a short visit. They say, hey, I really want you to participate in my breast cancer clinical trial. And that's all they talk about you and your breast cancer. And they say, I'm going to pass you on to my research assistant. They're going to tell you all about it. They walk out the room. I don't think this happens very often, but you want to make sure that you're a full participant in a clinical trial, that you understand what they're trying to achieve, what the risks are to you. So, God bless you have an adverse event, or your outcome is not as good as you would like. You want to look back and say, you know, I made a very good choice with the information I had, and I did not feel pressured to participate in a breast cancer clinical trial. So how do you find a breast cancer clinical trial? Well, the first place to start, as usual, is to ask your breast cancer physicians. Engage them in the topic. Do you offer breast cancer clinical trials? If you do not, and remember, most physicians are not offering clinical trials. Doesn't mean they're not as good as physicians that do offer clinical trials. But the reality is most don't participate. It's kind of an arduous process to participate as a physician in clinical trials. But ask them if they know anyone in your region that offers clinical trials that might fit your unique situation. And also ask them, do they think that you might benefit from a clinical trial? The second place to find clinical trials is online. And you can Google the terms, come up with a list of websites, and some of them are fantastic, others are ads, others are trying to draw you in for what someone's doing across the country. There are some search engines for clinical trials that are excellent. So you put in your cancer and your size of the cancer and what are the receptors and how old you are and where you live. And it can kind of take all these clinical trials and possibly match you up with specific ones that might fit your situation. Make sure to go to the Breast Cancer School for Patients lesson on clinical trials. And we have links to some of the best websites and search engines for clinical trials. Clinical trials are the foundation of advancing breast cancer treatment. Your participation in a clinical trial possibly could help you, but countless women in the future by changing the treatments that they will get and helping them get better care. Ask your doctor if they think you might benefit from a breast cancer clinical trial. To learn more about breast cancer clinical trials, visit the Breast Cancer School for Patients, where we teach you everything you need to know. We're here to help you get the best possible breast cancer care in your community. Register on our website to get our list of questions to prepare you for your next doctor visit.